How can you convince a patient who doesn't want more medications about a very effective medication, not only for losing weight, but also potentially modifying her cardiovascular disease risk?
And I guess I wouldn't use the word convince her, but I would definitely make sure I would educate her, and I would start planting the seeds. It might not be at this visit. If she is really resistant to that, then I'm not going to try to push that, but I may start planting the seeds and make sure she understands and thinking of the medication. She may in her mind think of a medication as it's a cheating, or it's they're not effective, or she may not know a lot of things that have made her feel that way. So we're going to start talking about that, planting the seed, not pushing her in any direction, not trying to change her mind, but just trying to lay some groundwork. I think the other thing, though, that, and I'd be interested to hear what Dr. Krishner thinks about this is, so many of these patients, when it comes to these diabetes/obesity, it's really more for the obesity, but now when you have the combination, don't want to be on them long term. They're okay with being on diabetes medications long term. For some reason, that sits well, but being on obesity drugs long term doesn't sit well. What are your thoughts on that? How do you handle that?
You're absolutely right. People still have this notion that their weight is their fault. It's their personal responsibility to tackle, and I shouldn't have to be on medication the rest of my life. Similarly, I shouldn't have to have an operation for my weight because it's my responsibility. And it gets back to education that you were just mentioning, Holly, is that we need to educate them that obesity is I don't use the word disease often. I use chronic relapsing condition. I kind of soften the blow on that. But I tell them that just like diabetes and hypertension, we think of obesity as a chronic long-term problem, which medication is going to be helpful. So and it takes more than one session typically to do that education.